Dr. Hackey normally gives the patients a catheter after surgery. He wraps up the penis, so that's normal, and that wrap will stay on until you come back to have your drain removed tomorrow. Okay, and then this drain is placed right after surgery as well to just catch any excess drainage. And you'll empty this at home and you'll record how much you empty each time and bring it with you tomorrow so we can make sure that it's not draining too much. Okay? And then the catheter, first we'll go over the JP drain, how to empty it, but I'll instruct you on the catheter too. Let's start with the JP drain. The purpose of this is to catch any excess drainage, and right now there's suction applied, but once you empty it, there will not be any suction applied. And the way you do that is you pull this little tab here out, and you see how it pops out like that? That means there's not any suction applied. So you'll just take your little cup and you'll squeeze whatever's in there out. Okay, so we've got that out. And you want to measure this for Dr. Hackey because he'll want to see tomorrow how much is in there. All right? Okay, so to reapply the suction, what you're going to do is you're going to squeeze it. And as you're squeezing it, you're just going to put the cap back in. Okay? And there's suction applied. Now, if you notice that you're not getting anything out and it's been hours, the tubing here may be clogged. So how we handle that is we will do what we call strip the tubing, okay, or milk it. And how you do that is you'll pinch down, you'll get as close as you can to where it's inserted, okay, and you'll squeeze, just take it and strip it like that, okay. You'll keep doing that all the way down, and that usually helps get it back going. Okay, but if it does not work, then that is a time you should call the office. If you've noticed that you've had a lot of drainage and then all of a sudden it stops to none, then you need to call us. The main thing with the catheter is you want to always keep it below the level of your bladder. You don't want to hold it up high because that urine can backflow and go back inside. Okay, so always wash your hands first when handling it. And to empty it, it's in a little sleeve. You'll just pull it out. Right now it's closed. To open it, you'll simply just push and that opens it like that, okay? So that's closed and open. All right, and then once you have it open, you can just dump it into your toilet or urinal or whatever you have at home. And try not to tug and pull on the catheter. We'll close it back and we'll put it back into the sleeve. Make sure you close it. All right. Okay, and so you're gonna get it out before you shower, but if you do, you're not supposed to be doing anything down there. But generally you would wipe away from the insertion instead of towards if you have to do anything. If there's any drainage or anything like that, you wipe away instead of towards. And then if you notice that the catheter is not draining, you should be getting in what you put, and you should be putting out what you put in. So if you drink 32-ounce water, then you need to expect that to come out, and it should be about 30 cc's an hour. Okay, but if you notice that's not happening, you need to check for any kinks before you call us. Okay, make sure that there's not any kinks in any of the tubing anywhere. Okay, and if that does not work, then you need to call us. Okay, because you may have some clogs in it. Okay, any questions on the catheter?
No, thank God.
Okay.